Well, I'm going to call today's meeting to order, June 2nd, 2021. And I will do roll call. Dick Kunert. I'm sure Dick will come on. Dr. Ed Copeland. Danielle Angelari.
Present.
Dr. Bill Gorski.
Here.
Dr. Terry Giardini.
Here.
Tim Neighbors.
Here.
Linda Sandquist. You're muted, Linda. So just for the public record.
I am here.
Thank you. And I did not say my name, Mary Ann Abadi, present. And when the other members join, please let us know. And we will, for the public record, make sure that you at least let us know verbally that you are present. And I thank you. Also, advisory members, Wendy Larson Bennett.
Present.
Jay Ware. And Jason Holcomb is
Here.
our staff liaison. So, okay, public comment. We did have one request, and then I understand today that it was Jeanette Towns, but she withdrew her request. Is that accurate or not?
Mary Ann, I understood that she was withdrawing her request, but she has come into the meeting room, so I think maybe it would be worth clarifying with her.
Sure.
If you
Is
have
Jeanette there?
admit her. Yeah, it looks like she's come on to the meeting.
Okay.
She's in the waiting room.
Okay. So it's at this point of the agenda that we, and just to review, the public comment section is for the board members to listen and not respond. We will discuss at a later date if it's relevant to our agenda. So, okay. Do you want to invite her in?
Yes.
Is there a time limit as well, Mary Ann?
3 minutes.
3 minutes, thank you.
Thank you.
Jeanette?
Yes.
Hi, Jeanette.
Hi, Mary Ann.
Good to see you today.
Thank you.
So we're not sure if you are wanting to give public comment or not. You would have 3 minutes to do so. Oh, you do. Okay, go right ahead.
I wrote it after you emailed me.
Okay, very good.
Thank you.
You're on.
Right now?
Yes.
Good afternoon. My name is Jeanette Towns. I am a mental health advocate and activist with lived experience. I am also an active NAMI member. My appearance before you today is an appeal for help. I receive calls from loved ones of the mentally ill when someone is in a crisis. I've discovered that most minorities in Rockford don't know how to get their family member hospitalized without involving law enforcement. Most of the minorities I've dealt with explain that when a relative is in crisis, paranoia also often ensues. Because of this, these families don't want someone in uniform to come to their home and escort the ill individual away in handcuffs as if being in a crisis is a crime deserving of a ride in a squad car. These incidents many times get escalated because of raw emotions and confusion. In today's climate, we have also seen these situations go awry. If the incident gets escalated too far, the person in crisis suffers more stress, on their worst day. I personally have been handled roughly by law enforcement several times years ago when I was ill. I was totally confused as to what crime I committed as I was being shoved in the back of a squad car. If there were a surefire way to guarantee that a mental health advocate would absolutely be required to assist on all crisis calls, to actively intervene for the client and calm the confused family down, things would drastically improve. Not someone for a follow-up call, one on the spot that day. Because of the closure of Singer, Oakwood Hospital, and Janet Waddles, there is a gap in services here in town. I often spend several hours with each family looking for agencies to help, from Adult Protector Services to Swedes to NAMI, and the list goes on. I try to help the family obtain gentle, understanding care. If we had a website with an up-to-date list of local services to assist people, I think that would cut down on the confusion. Rockford has many programs to help the mentally ill, but if the residents don't know about the services, who is really being helped? In conclusion, we need constant mental health professionals to ride along. We need a comprehensive database of services accessible to lay people. These solutions would greatly ease anxiety and help the person in crisis. Thank you very much for your attention to this matter.
Jeanette, thank you very much for speaking with us today. And certainly we will take your information and hopefully you'll see great improvement once all these programs are rolled out soon. But we need people like you to keep us, on track. Let me put it that way. So thank you for your participation today.
Thank you very much for the opportunity.
Thank you.
Bye-bye.
Donna. Thank you.
Okay. Very good points. Would you
Can I
say?
speak to that for a second? She's my
Oh, sure.
cousin. We were children together. Her father's sister is my aunt. So her father's sister married into my family. And she speaks to the points that I think I'm trying to speak to on this board as well. And it's why it's so important that we really get law enforcement involved in it. She's asking for law enforcement to be out, that there would be somebody else. But I think no matter what we do, law enforcement is just going to come in contact with this all the time, right? And, I had a complaint from last time, and the law enforcement people think that it's a training class that all of the officers go through, but it's more like CIT is the T is not training, it's team. There needs to be an actual team of officers that show up that don't have uniforms on, that do have mental health professionals with it. I mean, the sorry truth is that often mentally ill, it does get violent. And you have to have somebody who knows how to deal with that. That means it's a police officer, basically, but it needs to be one that has just a small team that has a whole different outlook on it. And that's what I was trying to say last week when I was.
Sure. I think, Jay, you've consistently given us this message, and you're spot on. As a matter of fact, if you just kind of hold your breath for a minute, I am hoping our co-responder program that we just funded is really going to take shape, because there is a lot of special conditions with that team, and they're all in the direction that you have been advising us, okay? To have that mental health professional on the spot, as Jeanette talked about. So I really feel that this is the goal we're working towards, and they're on board. Actually, it was very hopeful to read what they are proposing in return to our special conditions, such as, having a 24-hour service, having a mental health professional available 24 hours. They want to work with our board to really design this evidence-based co-responder program so that all of the essential components are there by the end of the year. It can't happen overnight. It takes so much manpower and training, as you talked about. So just bear with, we are, I think Jason will talk about this further today, but I just wanted to reassure you that I was delighted to hear what they came back with in terms of their willingness and desire. I mean, they were using real mental health language. It was inspiring. So I think we have a good start right now. So it's not done.
If I could just add, quite some time ago, Jay sent out to all of us some links to other communities that are doing co-responder type models. And in fact, I remember forwarding one on to Mayor McNamara. I think it would probably be a good idea for us to keep a close eye on those other communities and learn from what they're doing as their programs roll out, because they've started before we did, and they're going to learn things both on the upside and the downside as to what we can take away from it and what we can learn and do better. And Jay, I don't remember all the communities now, but there were a number of them. I remember when you sent those links. Denver or Portland or Spokane.
Portland was one, and
San
Antonio,
even
Texas.
Bill, Dick Kunert has done some recent kind of research and been able to get a video that is incredible. I think that if we can share this, and they're willing, they're anxious to move this forward in an evidence-based way. So that's real progress. That's all I can tell you. Being in the field for as long as I was, if you could get anyone from law enforcement to fully understand what we really needed, and I just feel they're there. They just need the manpower, and they need the training, and they need to see how other communities have done it, and they're ready. So Jason, did you want to add anything to this? Because I know it's coming up in our discussion items, but do you want to wait, or how do you want to handle it?
Yeah, I could provide some updates, I think, during the grant updates.
Okay.
As it relates to some of the specific programs.
Okay, I think that'll be great. We only have one action item, and that involves approving our minutes from the May 5th, 2021 meeting. So I need a motion.
So moved.
Do we have a second?
Second.
Okay, Dr. Giardini. Okay, welcome, Ed. Dr. Copeland has joined the meeting. So we now have a motion and a second to approve the meeting minutes from May 5th. Is there any discussion? Hearing none, I'll take the roll call. Dick Kunert, Dr. Ed Copeland.
Aye.
Danielle Angelari. Danielle, you were here.
Aye.
Thank you. Dr. Bill Gorski.
Aye.
Dr. Terry Giardini.
Aye.
Tim Neighbors.
Yes.
And Linda Sandquist.
Aye.
And Mariana Abadi. Okay, moving on to our discussion items. The first one being grant award and announcement updates. And Jason, I'll let you take that.
Okay. So just to give you an update, so far we've received 10 signed funding agreements and work plan packets that are essentially ready for our co-signature, and then they will be fully executed. We have 5 that had some type of recommended proposed change, mostly just adjusting a word here or there to make it more clear, nothing that substantially changed the nature of what we were asking for. And those have been reviewed and sent back. So there's 5 that have been reviewed and sent back and are just now awaiting signature from the grantees. And there are 3 that requested changes to the actual funding agreement itself. And those have been sent to legal counsel for review and for their opinion. I won't play attorney. I will a little bit. I guess it didn't seem like they were substantial changes to me, but I'll wait for that feedback. I think it was more or less, you know, in funding a lot of different types of agencies. Sometimes the language might have been seemed more skewed towards like a social service agency or something, and some of the municipal partners or other partners felt that, oh, you know, a word here or a paragraph there needed to be reworked a little bit. So we'll await the legal counsel review on that, and potentially, you know, it's hard to say the exact date. I guess I'm hopeful still that potentially by the end of the week we'll have them all fully executed. And so that kind of leads to the next point, which is the penciled in June 11 press conference date. If by the end of the week we don't have all of the agreements fully executed, then I think that we'll push that press conference back a week or 2. I don't want to put it out there. The press conference actually will be an open meeting because it will be, you know, more than a majority of a quorum of board members, and sorry, I'm losing my train of thought here. Because it meets the conditions of an open meeting, that board business will be discussed. We'll have to publish it as an open meeting. So again, I don't want to put it out there and then have to cancel it. I'd rather just push it back until we're confident that we'll have everything in order. So look for some additional correspondence, you know, by the end of the week on an update on that. I know that Mary Ann and Reverend Copeland are going to be coming in Friday to sign those agreements, which are ready to be signed and sent back. And really then we can start processing the payment affidavits on those particular programs, and people can start going to work. So just, I don't know if there's any question or comment on that before I guess I move to the next point.
I do have one, Jason. Is there any possibility that something could arise out of legal review that would be substantive enough that would require full board input to address?
Yes, that's very possible. And if that were the case, you know, at this point, we'd either have to put it on the July agenda or schedule a special meeting.
Special meeting, yeah.
Would it be substantial enough that we might have to go back to our grant list or applicant list for a different grant?
I don't think so, but it's possible.
Okay, all right.
But I don't think the changes were that significant, frankly. Okay. Well, I'll say nobody was changing the nature or the scope of their program. It wasn't that type of change, if that makes sense. I can clarify that point. And maybe I'll just say in general, so, you know, kind of this next part of the update, that we had intended to do one-on-one meetings with all of the programs in June to go over their work plans, and kind of a learning moment was that really everybody wanted to do those before they signed their work plans. So inadvertently, I've had one-on-one meetings with everybody through Zoom or phone calls to go over the details of their work plans. And I'll just say that everybody on the grantee side has been very very open to feedback, very, I think, grateful for the opportunity, and expressed a willingness to really work with the mental health board, particularly on those special conditions where agencies were, in some cases, being asked to go above and beyond even what they had proposed. There was very little pushback on that. Questions to provide context, questions to understand and clarify, but nobody was pushing back in the sense of saying, no, that's not what we're going to do. Absolutely not. There was very much a willingness to go above and beyond, in my impression of things. And certainly that was the case with both of the proposals that have been somewhat discussed earlier in this meeting, with the co-responder program, which, they did not in their proposal talk about off hours on call, but in response to seeing our special conditions and some of the concerns, have already started finding ways that they can cover those off shift hours with on-call services. So I think that's really encouraging start to that already. And then with the jail program, there was really no pushback on the special conditions. They've already started gathering and submitting some research for us to review as it relates to the suicide mitigation strategies and what they feel that they're modeling their programs off after, and have also offered for any and all board members to come and do a tour of the jail and to firsthand take a look at their mental health facilities. And I will note that they expressed that they felt that would be maybe helpful to the board to better understand why they were asking for the specific equipment they were asking for. So if anybody does want to schedule that, if you want to coordinate that with me outside of this meeting, shoot me an email and I can connect you with the jail staff. And of course we can, depending on how many board members want to do that, we can schedule a couple of different times to do that. So, really that's the gist of the update. I think I'll say, I guess, moving forward, there's kind of maybe some different ways that board members can get more engaged in different areas. I think, we kind of, at the very beginning, split off, and there were some folks that took an interest in planning and some folks that took an interest in communications. And then we kind of came all back together and focused heavily on the grant process. And I think that, over the next several months, there's probably different options again in terms of doing some community presentations. We've talked about that being targeted in July, August, and September. There's opportunities for those that maybe want to get more involved in the planning around specific program improvements, around some of the programs that had special conditions that required some additional planning to happen along with the implementation. There's that opportunity. There's the opportunity to be involved in the Learning Network collaborative meetings with all of the funded programs, or the open network coffee hour presentations. And so I may just connect with each one of you individually over the next month to find out where you'd like to specifically plug into those options. But I would encourage everyone to attend the press conference if you're able to, and also to participate in the reading of these program descriptions of all these wonderful programs that we were able to fund.
Is the press conference going to be at your office where you're at now, or?
We've actually booked the Veterans Memorial Hall for that to have a larger space that will accommodate more people.
All right. And what day is that, tentatively?
Well, tentatively, if we get everything in order, it'll be June 11th at 10:30 a.m. next Friday at yeah, a week from Friday at 10:30 a.m. And I can confirm those details, at the end of the week, depending on how things are with the contracts.
All right.
Okay, any other questions for these announcement updates?
And I missed the location. Is it,
Veterans Memorial Hall.
okay, okay.
By the used to be library.
So we have another discussion item, but before we get into that, I see Dick Conard has joined us. So for public record, Dick, do you want to just say aye for being present?
Aye.
Thank you, Dick.
Sorry about that.
That's quite all right.
This is Doug.
Okay, our next discussion item is new board member profile. And Jason, you have comments on that.
Well, essentially, just, I guess, reflect back what all of you provided for feedback. And then if you'd like to have additional discussion, you're welcome to do that. So for the types of viewpoints or specific representation that might be ideal for new board members, it was noted that there could be Latino or Latino Hispanic representation, that there'd be a viewpoint from a provider, educator, law enforcement angle that reveals unmet community needs, and that there would be representation of specific racial, age, or gender viewpoints. For experience, background, and qualifications, it was noted community mental health programming knowledge, experience with law enforcement and mental health professionals, experience in the behavioral health area, experience with budgeting, experience in children's mental health / domestic violence, experience with providing mental health care, understanding issues surrounding mental health and addiction, but don't necessarily need to be a professional, could have lived experience instead. And the last was like more or less like specific skills, soft skills or passions, so to speak. And that included passion for mental health, ability to have 5 to 10 hours per month of schedule availability, which could be increased during the grant review months. Understand the mental health board's vision, mission, values, and the community support program to prevent mission drift, and passion for community could extend to other facets of community life outside of mental health.
The Hispanic mention that's persuasive. I don't know that we've got a person in mind though.
I was thinking, Jay, I think the list is excellent. It almost seems to me you need to attach specific names to it to put up against the list of potential qualifications. It's kind of the way my brain works. I can look at these and say, well, these look great, but then who might be a person we would say, do they fit into enough of these categories that it would make sense? And I don't, very honestly, I don't have names either, but I like the way this turned out.
I have one name, but it's Mary Gubby Lee. I really, really, really like her. And I think she has a vision for how that whole law enforcement piece could go, that she's just better at explaining it than me. And she knows where they've been in the past. And, But I would like to have somebody that has the same passion I have, only has more college knowledge.
Is
So
the chairman expecting this from us and then he brings forward names, or is he expecting this from us plus names?
He's
Good question.
both.
Good
He
question.
he wants to get. I'm sorry. Can I speak?
Sure.
So he's looking for us to bring forth a name that someone that we would want to have on the board. He also wants the qualifications just in case he has someone different, but he's more open to who we want and he wants to match up with what we want.
My hesitation about giving names, Jay gave a name, and if you have a history of working with someone on boards and it wasn't positive, then we get into personality kind of things. So that's where my hesitation comes in. I feel like, we could give names, but how do we go about vetting the person? Because someone may feel they're really good, where someone else may have had really negative experiences being on boards with that person. So I'm just, I'm throwing that out there for potential hazards, put it that way.
But at the same time, it's still the chairman's choice. So we could develop what it is that we ask, or people ask them their resume to the chairman, or submit it to us. So we submit it to the chairman. And it's ultimately his decision anyway. So
Obviously it is,
he
but I
just
think we want
wants
to give,
guidance from the mental health board. Yeah.
but I think you want to have people that you've somehow vetted and know, how they function, and, that it's not going to be controversial, put it that way.
well, I mean, how we all got on this is that there was a call that went out, and if you were interested, you put in your resume, and that's how we all threw our names in the hat. I wonder if we should do that again to get a basket of names, and then we've got our description of what we'd like to see out of it, and they can look at that basket of names that comes forward and see which one fits it the best.
Mary Ann, are you thinking then that the other way, the other end of the bell-shaped curve, I guess, of doing this is just give this to the chairman and have him think of names as opposed to what Tim?
No, I mean, I just am trying to do it the best. I'm discussing it. I'm not really sure
Okay.
which is the best way, because for him to come up with people that really have the kind of in-depth knowledge and passion and understanding of the mental health system, but at the same time, I don't know. It just gets to be, we can give a list of names and he can pick who he thinks, but.
But Marianne, I do think that when Frank Haney was recruiting people, he sort of had sort of a list of criteria, and he also turned to people he knew for recommendations.
That is true. I will tell you that. He did his own vetting.
Right. And my suggestion would be to just maybe have a conversation with Chairman Chiarelli and say, how can we support your decision? I've been very impressed with the quality of collaboration this board has engaged in the last year or so in very negative circumstances. And we certainly would like to bring people aboard who are open-minded enough to, not have a personal agenda, but also have broad experience and encompass some of the things that we've pointed out, which is, we need a racially, ethnically, experientially diverse group who has at their heart a passion for addressing the mental health and substance abuse issues in our community. And I think until we have that discussion with Chairman Chiarelli, we might be overstepping a little bit by giving him a list of names. We've given him criteria and let the board make the offer. We're available to, brainstorm with you and go from there. Because there are, some people who wouldn't do well on the board, who wouldn't be helpful, but there are many people who would be. So my 2 cents.
Let me,
I'm
I
sorry,
guess what I would like
Okay,
to.
wait a minute. Dick, you are speaking. Raise your hand when you want to speak.
Okay, I'm sorry.
Go ahead.
Don't know how to get into this. We worked very hard with this board to and came up with our vision, our values, and where we were with our client population, meaning in a sense, almost saying the sickest and poorest that we have. I really, I love what we have as a mission and vision for putting up programs together for mentally ill people and those who are addicted within our community. I really, from a history point of view, mission drift, is a danger, and it happens when you bring people to the table who begin to change the mission and the vision of the organization, and so I think what we're really saying to them is, please bring us, if you're going to make recommendations, please have the people know and understand what the mission and vision and values of this organization is. And do you and can you ascribe to what it is that is doing? And so that's that to me becomes the sine qua non of the process. As to the second part, do we, well, I'll speak personally. I do have a short list of people that I know that I think would, number one, feel very comfortable with our mission and values and have something to contribute. So it's kind of like what Tim was saying. I think we could, develop a list of people with whom the chairman can talk and do his vetting as to where he wants to be with who and what he wants to do in the way of filling in within our board. But I think to me, the critical important thing is having people who buy into what it is that we're trying to do. Because I think, I don't know about I can't speak for anybody else, but I am terrifically, proud of like what we're bringing forth right now in the way of the package of services to the community that fit priorities that we have, we've developed and know that these are critical needs. But we're not through, and we have many good things that we can do. But again, we will continue to need a board who is mission driven, and that's all I'm really asking.
Yeah, and Dick, just to accentuate, your point about mission or sticking with the mission and not drifting. And maybe I shared this. If I did, forgive me. But I had talked to Patrick Phelan, who's the CEO at Sinisippi Clinic Mental Health Center. And actually, he deals with 3 mental health boards because of the counties. And he said that his mental health center and the wonderful programming that they are trying to provide for seriously mentally ill people have really not been able to get any funding, or so insignificant funding from these various 708 boards because of the mission drift, that they've gone to funding the boys club programming, to just things that are more on the peripheral. So what we have done is we're trying to, conquer probably the highest level of care problem that we have in our community, and make sure that we're successful at that. And 1 year alone is not going to prove that. We have 6 years to convince the voters to come forward again with this. But we have worked very hard at our transparency. That's what we've been just priding ourselves in, that we want the community to feel comfortable approaching and letting the community know our thoughts and sharing. Jason has done an excellent job with communicating all of our important issues. So we have more to go. We have a lot of work to do once we get these funded, because that's when our bragging rights really begin, in terms of going into all these smaller community groups that won't, to the depth that we're in, funding programs. I don't even think as a board, we truly know all the details that are promised and are going to open up access for kids and adults, including the geriatric population. So, we're just kind of at the tip of beginning. And that's why I think it is critical for, the balance of the board members to really buy into what we have going now.
Linda's have her hand up, Marianne.
I'm sorry, Linda, where are you?
I'm right.
I don't
Here I
see
am.
you on the screen.
That's okay.
Oh, now I see you.
Here I am. So I guess I have a couple of thoughts. First of all, it seems to me that this could potentially be an ongoing issue. So it seems as though a process needs to be put into place so that we always follow it regardless of who's on the board and who is the chairperson of the county, right? So I guess that's number one. Number two, I don't know if this is putting too much faith into the system or not. This is a public body. And is it worthwhile to think of a process where the board develops the criteria and what we're looking for, and that's made public so that people could fill out an application for that? Because I think that's very open, and that shows, it's transparency and it's trying to get people in the community involved, which I think would be a good thing. I think the check and balance on that could be the chairman, and perhaps the executive committee of our board vetting those and perhaps interviewing a handful and then making the recommendation back to the chairman that that's who he or she should appoint. So I guess I'm trying to think about how we could balance making it open to the public so that people do feel like they can get involved with this if they have the right credentials, right? Mm-hmm. But again, the check and balance is that the executive committee of this board, whoever that is going forward, because they're the leaders of this board, would be able to vet an interview and then with the chair make that recommendation for the new position. That's just an idea. But
I think it's a great idea. Dr. Copeland?
I want to second that. I think it's a great idea as well. Particularly on the part about the opening it, finding a way to open it up to the public, because number one, that's part of our values, but then number two, everybody, we, along with everybody we know, doesn't know everybody that we need to know.
Right.
And so by opening it up, you might find some unusual candidates that are under the radar, but that would fit the bill. But more importantly, just doing the process of what Linda just said, not only increases our credibility and shows that we are actually operating according to the values that we've stated, but we'll pick up allies along the way that we wouldn't have known about if we hadn't opened it up. In other words, we open it up and we get, I don't know, 25, 50, I don't know how many people would apply.
Yeah.
Just for an example, if we got 25 people who sent in their resume, for one position, that's 24 other people that we might be able to call on as we're doing other things in the community, because at least we knew they have the initiative and perhaps some type of passion. But the only other thing I would add is, first of all, everything that Linda said, I think is spot on, and I think we should go with that. The only other thing I would add on to the process is some piece that we make sure that as we onboard people onto our board, that we reiterate all the things that she was just talking about. In other words, catch them coming in and catch them as they're sitting down, to let everybody know that, this is, you got to leave your personal agendas, your personal political agendas at the door, that this is what we're about. And I say that simply because I'm old enough to know that nothing is foolproof, because some fool will always prove you wrong. But the more you can sort of reiterate our values, I guess is my point. And that's what she's talking about, on the front end in terms of opening it up, and this is what we're looking for. And then with our executive committee, along with the chairman, sort of making sure that's a piece, but then having a process for onboarding our board members that reinforces that whole piece, so that, so that we can hold each other accountable. So when somebody is acting out of selfish interest or whatever, we can point out, no, we've gone through a whole process. You went through this. Now I get to hold you accountable if you're not acting according to our values.
I agree with that, Ed. And I know Dr. Gorski had his hand up too. So we'll go to him. But one other thing, we'll have to actually talk to the chairman about this to find out if he's willing to have that much of our input. So, but anyhow, Dr. Gorski, what you?
I think I'm thirding Linda's comment. If Ed seconded it, I'm thirding it, but maybe with another, that's where I was going to go originally, is this idea of process. I think any way you cut it, and however you cut it, some sort of liaison function between the board and the chairman seems appropriate. And without, I don't want to sound like I'm making an argument against public transparency, but respecting our obligations to the Public Meeting Act, are we still okay with 2 board members not being a public meeting?
Say that again, Bill, I'm sorry.
Are we still okay, given our numbers, that 2 board members do not constitute a public meeting?
Yes.
I'm just thinking of the sensitivity of, and I really like the idea of the criteria and being open and seeking interested individuals from wherever they come from. They could come from members of this board, could recommend people.
Sure.
But then a smaller number of individuals who can take the deep dive, can do the vetting, can get into conversation with the chairman. And it just seems to me that it may be best to do that in a non-public setting.
Well, I feel that way too. That has been my hang up all along. It's like throwing names out there and then, talking about individuals publicly just does not seem very ethical to me.
No, it doesn't seem respectful. And depending on how it turns out, it's not respectful to those individuals often. And yet, I think we're kind of all tracking on the same thought. There needs to be some connectivity with the chairman, but perhaps it's just 2 of this board figures out a way to receive and vet names with the chairman, so that it is his appointment, but with our input in a way that's thoughtful and careful, and yet doesn't embarrass anybody. I guess that's kind of what I'm thinking.
Mhm. So Linda, you had a comment.
Yeah, I just wanted, and I put it in the comment box. I had not thought about the Open Meetings Act, and I agree with Bill. So maybe it's our chair and vice chair taking that on, and that's part of the process, right? Because what I'm hearing is that if we have two people from our board with the chair, it is not an open meeting. Is that correct? A public meeting?
Yes, it's two people and Jason.
And Jason.
That's all legit.
Okay,
So two people and the chairman, that would not be open meetings.
Okay,
But what I'm wondering is how, in fact, then, maybe Jason, you can help me with this, that if, in fact, we want to get input from the other board members, once there's finalists, maybe that the chairman is saying, these are the people that, I feel really comfortable with. Would you meet with them? And our chair, myself and Dick would meet with them, but then we'd want to be able to get input from the rest of the board. So individually, if I were to contact Linda and discuss, or contact, Dr. Copeland and discuss, that would not be a violation, and we would be able to have that input correctly. Is that right, Jason?
That would be my understanding of the Open Meetings Act, and I think that just as we did with the grant reviews, we could, we got feedback from multiple board members who independently scored applications. So we could certainly facilitate a process for that to meet the board's preference.
Okay, Tim, you have your hand up.
So I know on the process that we use for the county board, so everybody gets an opportunity to vet the person that they want. The county board, when the appointment comes up, the county board chairman submits the resume to the whole board in the Public Meetings Act, and then it has contact information on the person that was has the opportunity to get on a particular board, and then each board member could contact that person individually and talk to or interview or vet that person individually.
Okay, that's
So
another way to go about that.
Right.
So I think I'm wondering, is there a filter mechanism even before that step? Then could there be, so many suggestions that, let's say it is you and Dick and Jason and the chairman sit down and say, well, these individuals appreciate their willingness, but they really don't fit into these criteria.
Mm-hmm.
And then once they are brought forward, I think Tim's point, I would hope that all of us will get a chance to.
Right, and that was my point.
Yeah.
Yes. Because we want the total board, buy-in to be able to feel comfortable.
Yeah.
Yeah.
Okay, well, I think that would be an excellent proposal. And my next question is, who would bring that forward to the chairperson? Jason, is that something that you would bring forward from the total board discussion today?
I would be happy to contact his executive assistant to schedule a meeting with.
That would be great.
Whoever among the board would like to carry the water on that.
Well, isn't Tim the logical person?
Yeah, right.
Yeah.
Yeah. That was going to be.
I don't mean to load you into boat, Tim,
that was going to be my suggestion, that Tim, Mary Ann, and Jason.
I have raised my hand.
Have the conversation.
Yeah. Tim already volunteered, but he's there. He's, he'd be the logical person. So, and Tim, if you would like me to accompany you or be a part of it, I'm happy to do so, however you want to handle this. And Jason as well.
It's no problem. I know he's already spoken to me, and he's waiting for some type of conversation with today. I told him I'd get with him today to let him know how we want to move forward. So,
Oh, okay. Well, that's great to hear.
Well, and I have another question. Do you think that this would come in the category of like personnel matters? So that when the board talks about particular individuals, that would be a closed session?
We're
That
not going to talk publicly about the person.
No, that's what I'm saying.
Yeah,
That's a way to get, and
It'll
I don't
have
know,
to be a
Jason.
one-to-one kind of thing for Dick and I and Jason to spread out and get the input from all of you individually. So at least,
Mary Ann, I think what Wendy's asking is kind of, do we need to talk to our attorneys and ask them if about this as being one of those times when the board goes into closed session and has the discussion. Am I incorrect about that, Wendy?
No, that's what I'm suggesting is touch base and just ask, is this in that nature? So that the board, there's a certain synergy that you have when it's
Right.
all the board as opposed to one-on-one conversations. Just, like.
and Jason, have you heard that that's a possibility that we can do a closed meeting for a personnel, adding a board member?
I'm not familiar with this specific type of situation, so I think I would have to ask.
Definitely.
Oh,
That'd be great.
That's a great point.
It would be easier
Mhm.
and probably a richer conversation to do it that way by far. So,
Yeah, great point.
but at least, Tim, you're going to convey our recommended process
yes,
at this point to the chairman.
yes.
Thank you. Okay, is there any further discussion on the new board member profile? Tim?
The other thing I wanted to know is there a timeline to where we would have this process develop and names? Because he's looking for a name like real soon. So I'm also because he also expects a name. So I just let him know we gonna develop a process, but at the same time we need to be aware that he wants to do it real soon.
Well,
while
that's
we
fine
develop this
because
process.
we have the criteria, so that could go to him immediately. And if he has names and we then submit names, he can vet the group, and then we can begin the vetting process. So Jason, in terms of how the chronology here should work, should we be submitting names to you independent of the next meeting? And then these names could be, I don't know. How should this work?
So what I heard, or what I thought I heard as the understanding of the process would be to take the criteria, which was reviewed, and to open up a public application process of some sort in which people could submit applications.
Good.
So pending the outcome of Tim's conversation with Chairman Shirelli, if they would like us to take the lead on that, creating some portal. I don't know exactly off the top of my head how we would do that, but I'm sure it's something that could be done on the website and pushed out through the mental health board's communication channels, if that is, how it's being proposed.
Okay, one comment on that is that in reality, it isn't an urgent matter, because in terms of the number of board members we have, we lack one. We still can do our business without the one. But we want to make sure that we have a timeline so that the chairman would feel comfortable that it isn't being pushed out too far. And Dr. Gorski, you have a comment.
Well, I'm glad Jason brought that up because I had heard that also, that we were talking about a public posting of these
Right.
criteria. It seems to me, does anybody else feel this way, that we would need to make sure the chairman is okay with that part of the
First,
process?
that's what
Yeah.
Tim is going to find out today.
Yeah, because he may say, well, no, I didn't see it that way. I see.
Absolutely. We would never do that until we get
Okay,
the
good.
confirmation from him.
Good. Okay.
He has to accept our, really our involvement in this process.
Yeah. Okay.
That's what Tim will ask him today.
Yeah.
Linda has her hand up.
Oh
Mary
my
Ann must
goodness,
not be
she's
able to see me.
invisible. Yes.
I think you could make it a quick process this time also. You know, if somebody is interested and you gave them 2 weeks to put in their application, I think you could do that. That would allow the chair, if he knows somebody who he wants to apply, then those phone calls can be made, or email sent. So for this particular one, if it's more urgent, do a short process. The other thing that I was just going to comment on, because I know Dick spoke so passionately about having people adopt our values. I think I would put in the application process, these are the mental health board's values. Do you agree with them, and make them sign off on that so that they have to read through that. And then we know they're already saying that they adopt the values of the board.
That's a good point.
Take ownership for their words.
Yep.
Agreed.
Yeah, I think that's a great point. And the other, as you were just talking, I was thinking about the fact that before people submit an application online, they have to have the criteria ahead of time. So that would have to be, stepwise, the first thing they would have to have access to in order to, find out, reading through that, if they're even qualified to submit an application.
And I'm wondering, I know that we had thought that we need Hispanic or Latinx representation. Is it possible, and I would just throw this out, to say preference at this time will be given to, someone with of that background? I don't know. Jason can figure out how to say that, and I don't know if we run into politics or not. So just throwing that out.
Yeah.
That may be a real grabbing a third rail. That's
Tim.
pretty aggressive.
So just we are a 7-member board, right? And so with us missing a member, that reduces. So that means we're a 6-member board as of right now.
No. We have 9 members on our board.
9. Okay.
And we have 2
I was just
advisors.
Okay, I thought it was 7 and 2 advisors.
I mean, that's what the original resolution called for, a
That's
7-member, but he expanded it to 9. So that was why I was saying this is not an immediate emergency in the sense of our functioning. We have 8-member board right now and 2 advisors.
Okay, because I was
All
just
right.
worried about the majority of a quorum when we get together in our small groups.
Mm-hmm. No,
So
it'll,
we're
what,
still fine
will
with
that change with 8 members? I don't know.
not with 8, but
Yeah.
yeah.
Well, to be semi-self-serving, there are already 2 advisors. I mean, that, picking someone there might be a way, just an idea, to fill the unexpired term. But I don't know how Jay feels about it. I don't know how I feel about it, but that would be quick and dirty.
That's an idea. Well, it seems like the next step is Tim and Mary Ann and Jason probably have a conversation with the chairman and sort of repeat this discussion and all these ideas and see what he's comfortable with.
Mm-hmm. I think that's good. I mean, it's gotta go to the chairman now, the next step. So Tim will be talking with him today, you said. Is that correct or not?
Yes, that's correct.
Okay.
And if I could just say one thing and follow up to Linda's comment, if a specific comment about diversity is from a specific population, maybe he doesn't feel right, I would be in favor of stressing diversity in all ways that diversity can be interpreted, particularly as we're dealing with individuals struggling with mental health, whether it is age, gender, ethnicity, identifying underrepresented communities and who might be someone who could bring that voice here. I don't want to water it down, but in that respect, I think the chairman would understand where we're coming from.
Yes. I agree. Okay, so Danielle, you got that all in the minutes here?
Thank you, Danielle.
That you can hopefully make sense out of it. And, whoever included this on the chat line, it says, make application public. Mary Ann, Dick, Jason, and Chair vet and make recommendations to the board. Vetted names released to the board and board votes. I mean, that's kind of the sequence of events, but this is all after the chairman agrees. So, okay. Any other discussion about this right now? All righty. Other matters, I actually did not have anything on the agenda, but I did want to share with the board that I was able to have lunch with Julie Morris, Dr. Morris, and thanked her for her contribution to our inaugural board. And she let me know that they will be moving at the end of June. That's when her contract is up with the district. And she already has a new job with the regional office near where they're moving to, which is near Joliet, as I understood. Hopefully that's correct. But nevertheless, it's a regional office, and she is going to be developing the social and emotional curriculum for the school system that she's involved in down there. She'll be in charge of no one. She wanted me to know that. She has no administrative responsibility, but she's a young person. She's not ready to be done yet. So, and her husband has a couple years, but she said she learned so much and got so much out of being on our board and loved all the board members. So I'm just bringing that back to all of you.
Thank you for that.
Yeah.
So that's it for other matters. And the only other business is a motion to adjourn.
So moved.
That was Dick Cooner. And I need a second. Tim?
Second, whoever.
Any?
Third.
Oh, third. We've got 3 motions here now. Nevertheless, although I'm going to have to take roll call to adjourn, as you recall. Mary Ann Abadi, I would say A. Dick Cooner.
Aye.
Dr. Copeland.
Aye.
Danielle Angelari.
Aye.
Dr. Gorski.
Aye.
Dr. Giardini. Well,
Aye.
motion, but-
Okay, sorry.
Tim
Play
Neighbors
paper, scissors, rocks.
and Linda Stanquist.
Aye.
Okay. Well, thank you all, and we'll look forward to seeing you in July.
Okay.
Okay.
Thanks, everyone.
Thank you very much.
Aye.
Enjoy. Hey, Ed, next time we'll play paper, scissors, rocks and see who we get that next one in.